Hello, my name is Caitlin Behrens, and here is my ATC 225 final video. So my goals were for the class to differentiate the difference between occupational therapy and physical therapy, and also learn more about what it's like to be a physical therapist. And I didn't get the chance to shadow the occupational therapist I wanted to, because I was gone for half the class because I was in Alaska on a cruise, and then I got really sick right before everything kind of started happening for the class. So I didn't get the opportunity to do that, but I'm definitely going to do that in the near future. I have dates set up with her just after the class ends. So this is something that I'm working towards right now currently, but just not something over the course of the class that I managed to reach. And then I did learn a lot more about what it's like to be a physical therapist. Honestly, this was super beneficial to me. Even though I had shadowed in the past, I feel like this was just a different experience, and it was a lot more beneficial to me than any of the other shadows that I've done before. So the first place that I shadowed was Ivy Rehab Physical Therapy, and I shadowed Crystal Crater. Crystal Crater is a PTA, so she's not a DPT, which is what I want to go to, but one of the main differences between a PTA and a DPT is that a DPT can do an eval, and a PTA basically does most of the other stuff. But she was super helpful and super beneficial. The place that I shadowed out, Ivy Rehab, is a chain physical therapy place. So it's just kind of, a lot of them look similar, and it was just like an open room, had 4 tables, and a lot of workout equipment. There was 2 DBTs and 1 PTA, and I shadowed the PTA. There was a few surprises for me. There was a wide range of care that was provided. There was anything from a foot to a back to a shoulder to a neck, anything really, and I really liked that. This is also not a surgery center for sports, and there's a lot of variety. There was some sports players. There was just some people that were just in general pain, just kind of had chronic pain. Nothing really caused it. There was some people that did have surgeries. So it was really just anybody. Like I said, it's a chain, so literally anybody can go there. So it was nice to see a wide variety. And I did get to see some dry needling and scraping. The dry needling and the scraping is something that I had seen before, but it was just something that I thought was really cool, and I'm really glad that I got to see it. So the clinical requirements are professionalism. You have to act professional around the clients, and you have to know what you're talking about, and also just talk to them in a professional manner. It is your place of work, and even though you might know some of these clients, like they're your friends or you've created friendships with them from working with them for so long, it's still really important to maintain professionalism with all of the clients. You also have to have a lot of social skills, because you're working with these patients for an hour, so you kind of have to talk to them for an hour, and you do get pretty close with some of them from what I've seen, because some people have been going to Ivy Rehab for years. There was one patient who had been there for 3 or 4 years. So you really do get to bond with these patients, and that's something that I'm really looking forward to in the future, and I'm really excited for. But also just kind of shows that you do have to have social skills to be able to be a physical therapist and create bonds so that people will refer them to you and you can have more patients. You also have to be knowledgeable in everything that you're doing, because a patient could be like, my back hurts, why are you working on my feet? And then you kind of have to explain to them why you're doing what you're doing and how it will benefit them in the future, and then hopefully they'll be a little bit more optimistic and will look at your point of view and not just be like, my back hurts, please work on my back. Because a lot of the times there's another problem that's leading to the back problems, and that could be in your hips, in your hamstrings, in your calf muscles, or even in your feet. So just kind of making sure that you know what's going on, and also keeping your mind open too. You also have to be able to work with other coworkers. If you're not able to work with other coworkers, you're going to have a really tough time, because a lot of things are, I overbooked my patients, and I see that you don't have any patients at 11 o'clock. Could you please take one of mine? And if you guys are friendly with each other and are good at working together, then it will make both of your lives easier in the long run. Even if you don't like them very much, even just being like friendly with them and being able to work with them is the biggest thing. And also, you have to be able to take good notes and set good goals, because you have to do progress reports on patients and update thoroughly how they're doing, so that just in case you're not there for a day or someone else has this patient, they know what's going on and know what you're working towards, as well as this will help other therapists meet their goals too, because most patients have goals that they're reaching towards, and then the therapist also has goals to help the patient and like what they want to achieve. So if someone has a hip problem and their gait is off, fixing their gait will be one of their goals. So having goals like that to work for is something that's really important, and you need to be able to do that well. So some of my takeaways from this place, this setting taught me really just about physical therapy and like what it's like to be a physical therapist, none of the behind the scenes or anything. I got to see patients doing their exercises and stretching, got to see dry needling and scraping, and I also got to see hands-on massage, manipulation, and a glute release, which I thought was pretty cool. Most patients, half the time, are probably just doing their exercises or stretching. On the occasion, you'll get the dry needling, and most patients do get scraped, or did get scraped, at least where I was, and most patients also did get hands-on massage and manipulation. So I thought that was really cool, and I'm really excited to be able to perform that on some patients. One of the patients that Crystal saw, her calf muscle was super tight, and it was there was like ripples in the muscle, and whenever she was scraping her, you could see it, and you could even see it in her hand. And she told me to come over there, and I got to help scrape this client just a little bit. She really just wanted me to feel the like bumps in the muscle, and I thought that was really cool, and I was very fortunate to do that, because I know that not everybody gets to do that so early in the process. But I was really thankful that she let me do that, because it really did help me learn kind of how scraping works a little bit better, and also what you're feeling for whenever you're doing that. So I'm really fortunate that she let me do that. My second place that I went to was State Farm Pool, and I did Abby Eckhoff. So the clinic, I was with Abby Eckhoff. This is at a public pool, and at the pool, there's obviously pools, there's a lazy river, diving boards, and there's some slides. It's very busy and loud, and something that really surprised me was the amount of incidents that happened. There was poops, saves, throw-ups, and even some animals in the pool. There was a bird in the baby pool, and it was just kind of eye-opening to see how often this does happen, especially at a public pool, and kids can't swim very well. I also got to see how to make this schedule, and the people that she was making the schedule for was around 60 people, a little bit less. So it was just interesting to see how to make a schedule for that many people who have such different like availability, and also working around people's time off, because she was making the schedule for the weekend that we had a music festival in town, and there was not that many people available to work, so that was a little bit different. But she also showed me like a normal weekend or a normal week and how to do that, because you have to balance the amount of people that are working every single day, accommodate everybody's availability, and making sure that there's not too many people or too little amount of people working. So it was just really interesting to see the process that goes on behind scheduling a large group of people like that, and it was super beneficial. So some of the clinical requirements for being a pool supervisor is being knowledgeable in all the saves, whether it's an active save or a passive save. She also has to be super knowledgeable in CPR, BLS, which is basic life support, and first aid, because a lot of the times if the guards are a little bit questionable, or something happens on the pool deck, the supervisor takes care of it. So our supervisors are the people that kind of come first and help more because they are more knowledgeable. They also have to talk to patients and answer questions. This has to be in a respectful manner because the person could be being super disrespectful to you, but you have to be very respectful to them and kind of just like keep your cool. So you have to be able to do that. And also, there was a lot of instances of PDA in the pool, so she did have to break those up. And it's honestly just making sure that you're comfortable doing the uncomfortable a lot of the times. And I thought that that was honestly super beneficial to learn because being a physical therapist, you could tell that your patient might be overweight or something like that and tell them, hey, I think that you do need to lose weight. Or something like another situation could be that the patient isn't doing their exercises at home and be like, hey, I know that you're not doing your exercises at home because you're not progressing as quickly as you should be. Could you please work on doing that or something like that? So just like being comfortable with the uncomfortable. Also make the schedule for around 60 employees, everybody with different schedules. I also learned how to do pay for hourly wages. This was helpful because I know that a lot of PTAs are on hourly instead of salary. At least at Ivy Rehab, that's kind of how it was. But also, that's just a good skill to learn how to have, especially if you want to have your own clinic like I do. I thought that all of this was super beneficial because I got to see the behind the scenes and kind of just like how to run a business kind of. And this was just super beneficial. I also learned very quickly how to work on my feet and problem solve. At one point in the pool, we had a save and a poop at the same time, and just having to deal with that at the same time with only one supervisor being there was super stressful. So, because with the save, you have to fill out the incident report form, and I also learned how to do that. So, filling out the incident report form, contacting maintenance to figure out the poop, keeping patrons out of the pool, and like just dealing with all their questions kind of all at the same time really taught me how to work on my feet and like problem solve and kind of just like also keep my cool if there's a lot going on. It was beneficial to see that. Also taught me how to run a business with a lot of employees and that has 500 patrons coming through daily. So the pool has about, on any given day, around 500 patrons, give or take a few hundred. Really just depends on the day, but this was really beneficial because, I mean, as a supervisor, you're doing a lot kind of running the pool and making sure that everything is running smoothly and that all the lifeguards are doing what they're supposed to. So that was really beneficial, kind of just like to oversee everything. I really enjoyed that. And then also had to fill out incident report forms. This could happen being a therapist. Somebody could fall. Somebody could, I don't know, fall and get hurt, whatever. I know that they signed forms and stuff before, but probably still beneficial to know how to do an incident report form, at least in this place of work, just to kind of have an idea. So my takeaways, this was very, very beneficial to me, and it was more beneficial to me than you would think because I do want to own my own business. So it was helpful to see more of the business side and kind of like how to run something like this and what goes on behind the scenes. I really do think that learning pay, learning how to schedule, and everything else like that was super beneficial. Yes, I may not have to schedule 60 people for my job in the future, but even 20, like something like that, even 10, just working around that and seeing how everything went, seeing what went into it, and just like giving me a background really helped. And it, like I said, taught me manager, supervisor, clinic director skills, and I really, really thought that was beneficial. And also, there was a lot of valuable life lessons and life skills. So going into this, I wanted to be a physical therapist, and I still do. Going to Ivy Rehab is very beneficial for me for the physical therapy side of it and being a physical therapist. And State Farm was very helpful to me for running a clinic and in those cases of emergency. What if someone goes into cardiac arrest or trips and falls and I have to do first aid? So it was honestly a really good balance, and I'm really glad I did both. I've wanted to be a physical therapist for a few years now, and these experiences have ensured that I do want to be a physical therapist. So some of the highlights, at Ivy Rehab, it was dry needling. I only got to see this on a few patients, and the DPT was able to do it, so I did get to see that, which was really cool. Scraping, I got to see the scraping on the neck, the foot, the ankle, even the calf. This was really beneficial, and like I said, I did get to do it a little bit with the patient's consent and the PTA's consent, so that was awesome, and I'm really glad I got to do that. And I also got to see a glute release, and I thought that was pretty cool. This person had a lot of twitching, so that was really cool to see. And then at State Farm Pool, I got to see saves, how to make the schedule, and how to do pay, and those were just really beneficial for me to see. So here's some comparisons. Ivy Rehab was more calm. Each therapist had about 2 to 3 patients at a time, usually like 1 or 2, but it would get up to 3. There was a lot of equipment. There was bands, balls, weights, machines, anything that you could think of really that would be in a physical therapy office, they kind of had it. All people are welcome. We saw a range of 12-year-olds to 80-year-olds, so there was a wide range. This was strictly PT and like kind of what goes into being a PT, actually doing like the therapy and then doing the notes and stuff like that. And then the employees, all of them went to PT school or PTA school and have kids. So it was like an older, not old, but like they had been on with their lives. And then at the State Farm Pool, it was chaotic because it was really loud. There was up to 500 patrons in a pool per day. There's a range from like newborns to 80-year-old people who are the patrons coming to be at the pool. There was swimmers, tanners, floaters. We have a lazy river, so anything like that. There's a lot of younger kids too, but some teenagers and some parents too. Most of the incidents reports that we had to fill out were around 8 to 10-year-olds, and the employees range anywhere from 18 to 23-year-olds, so just a different group of people. So, but this really opened my eyes to a lot of things. And here's how teamwork works. So in Ivy Rehab, PTA asked the DPT a question to make sure that the patient was getting adequate care. And then the PTA and the DPTs split patients to make sure that the care is adequate. DPT did have to do an eval, so PTA did have to take the patients during that, like most of the patients during that time. So just kind of like splitting up patients and making sure that nobody's overworked and nobody has nothing to do. So just really doing a good job of making sure that everyone had something to do, but not too much and not too little. And then at State Farm Pool, all lifeguards are required to work together and make sure that the pool runs smoothly, and the supervisors make sure that the lifeguards are making everything go smoothly. And supervisors are also assigning spots so that the lifeguards can make sure that all the water is washed, which is super important. And then there was a little bit of help with the schedule, but not too much. It was mainly just one person. It was mainly just Abby doing it. And then the challenges at Ivy Rehab, not having too many patients to see and balancing out patients. At one point, Crystal did have 3 patients, and that was kind of a lot to balance because some of them needed the same thing at the same time. So just kind of having to balance out what you're going to do and how you're going to do it. And then dividing between PTA and DPT depending on the circumstances. So the DPT did have to do an eval, like I said. So then Crystal had to take in more patients. And then at State Farm Pool, supervising teenagers and 20-year-olds, that can be difficult and really taught me a lot of lessons because people are disrespectful, people are, I want to do this now, can I please leave, like all this stuff, and just kind of like how to deal with difficult people to work with. And then this also taught me that a lot of incidences happen all at the same time. We had multiple active saves at one time with one supervisor, so that was a little crazy. Having 2 saves in different areas of the pool was really crazy, and it kind of just taught me, again, how to work on my feet and, like, stay calm, problem solve, everything. So here is my experience in ethical leadership, being in charge of employees and leading them to do no harm and give care ethically. Saw that in both because ethical leadership is honestly the foundation of these, because as a physical therapist, you have to make sure that if you are the head physical therapist, for example, you have to make sure that everybody is doing their job and not doing any harm. Same thing with being at the pool. You have to make sure that if something were to happen, people are not gonna just not do anything, and make sure that they're doing it correctly. If there's a baby, you don't want to like crush them by giving them CPR. You want to do it a little bit more gently. Cultural competence. So in my town personally, we have a high population of Indian people. So being able to communicate with them respectfully, as well as communicate with them as you would anyone else who comes to the pool, no matter their culture. There was some people that we work with that are disrespectful towards people who don't look like them, who you can't understand or anything like that. So honestly, just like making sure that you are open to any walks of life, and anyone who comes in, you're going to treat them the same. And then community engagement at the pool, making sure that all the patrons are safe, and honestly just like helping keep this place open so that the community has somewhere to go in the summertime. And then for IV rehab, making sure that the people in the community are getting the care that they need to be healthy. There's a lot of physical therapy places in my town, but this is just one of them, and there's a lot of people that come through. So really making sure that this is a good place that people can come and you can serve the community and be involved in the community and help members of the community was really beneficial. Overall, I'm really glad that I got to experience both of these places. I really do think that both of them were very beneficial, and I'm super excited to be a physical therapist in the future.